Today we have the privilege of talking with a living legend, Dr. Beverly Coleman. Dr. Coleman is the first African-American female full professor of radiology at University of Pennsylvania, first endowed chair of fetal medicine at Children's Hospital of Philadelphia, and the first African-American president of the American College of Radiology. She'll walk us through her journey growing up in segregated Pine Bluff, Arkansas, to Vassar College, and then to graduating from Harvard Medical School in 1974. Dr. Coleman has gracefully leaped hurdle after hurdle, achieving a long list of accomplishments. She's reached so many by helping countless patients, lecturing all over the globe, and having a hand in teaching numerous practicing physicians. As she shares her story, it will be obvious that her guiding lights are patient-centered care, decreasing disparities, and never giving up. She's a force that won't be stopped. What an honor. Let's go.
Excuse me, is this the reading room?
Yes, I'm Dr. Saad Manzoor.
I'm Dr. Travis Howard.
Welcome to the reading room. I'm Saad Manzoor.
And I'm Travis Howard.
Welcome to Reading Room Talk. Thank you for pressing play. We have struck gold.
Yes, we did. We're so happy to be here.
Yes, we are here with Dr. Coleman.
Yes, the legendary.
There's no words. There's no words. There's no words. We really, really appreciate you allowing us to be here with you today. And we're looking forward to hearing all of your stories about everything you've been through. So the first question I'm going to ask you is, take us back to medical school. What was your toughest class or rotation in medical school?
Okay, that's an easy one. I would say surgery and Mass General.
Okay.
And the reason I say that is surgeons are always up early. The OR opens early, and the cases tend to occur at the crack of dawn.
Mm-hmm.
And I was living in Vanderbilt Hall.
Mm-hmm.
And as you know, Mass General is a distance from there. So my routine was to grab the train. And unfortunately, my surgery rotation was during the winter. So we had this huge storm, and it was an ice storm, snowstorm. And I got up as usual, walked to the MTA, and I stood there in the cold.
What time was this?
The train wasn't coming. It was in the dark.
Oh, yeah.
Okay. And this was before cell phones and
you didn't have a Google alert to tell you when
told
they're
you
coming.
what was going on at the train. And I wasn't the only person standing there, but we were standing there waiting for the train, and it was obvious that there was something really wrong.
Mm-hmm.
And I was looking at my watch and checking the time. Then I started to cry, and I'm not a crier. So that was very traumatic.
Because if you were late,
yeah,
it was going to be a
that's
problem.
right, because they didn't want you late for surgery rotation, and I was the only person of color on the surgery rotation. That was another issue.
Mm-hmm.
Extra
and
pressure.
My husband, who I'm married to this day, is a dentist.
Okay.
And he had a little blue Volkswagen Beetle. Okay. And basically, I called him up, and he was like, "What is going on? You're crying." It was, like I said, it was crack of dawn in the morning. It wasn't even dawn yet. It was dark. And he had, in the old days, they had these little sprays where you sprayed a lock, because the lock on his car was frozen.
We would freeze up. Yeah, it's cold. Yeah.
So he grabbed his coat, he grabbed his spray, he sprayed the lock. The old bug started up because it was used from a cousin of his. Wow. And he came and picked me up at the station where I was standing there right at the corner and got me to the surgery rotation.
Wow.
Oh, wow.
Okay. And I was able to get in there, dry my tears, get out of these frozen clothes, get on my white coat, and get in line for the rounds. They make the rounds, and they're standing there, and they ask me, "Well, what about Miss So-and-so?" So I made it. So that I considered my toughest rotation of all.
Wow.
Because of the time of the morning, the time of the year.
Yeah, in Boston, it's like dark.
And and the hours. Yeah. In other words, it's not like radiology in the sense that I would know when I was on call. I would know when I had to do nights or weekends or
Right.
whatever. Surgery is like you go at the crack of dawn in the morning and you stay till the work gets done.
Period.
And that's right. And it may be 12 hours, 20 hours, 48 hours, or whatever it is. That's it. So, and also surgery was one of the rotations where I lost my first patient. So that was
that's
traumatic.
tough. Wow.
Yes. And they made it my job to be with him, hold his hand, talk to him, and do all this stuff. And he knew he was going. I knew he was going.
Yeah.
And it was really traumatic. But all in all, when I think about everything, that was a toughie.
Wow.
But I survived it
Yes, you
because I'm a
did.
fighter.
Yeah.
And I just
That's right.
kept on moving.
Yeah.
I said, no matter what they do, I'm getting through this rotation. And I got a B, which was good enough for me.
A B at MGH.
Yeah.
That's an A anywhere else.
That's right. Exactly. At MGH, that's right. That's the way I looked at it.
That's
Okay.
absolutely right.
Okay.
So, Dr. Coleman, how did you make it? Well, what do you think helped you the most?
I think it was my drive and my stamina because, coming along, nobody in my family had ever been a doctor. That's the first thing.
Wow.
Okay.
Mhm.
And when I was at Vassar College and I said I wanted to go to medical school, one of my faculty members said to me, why do you want to go to medical school? Why don't you just be a nurse? So I knew, okay,
Mhm.
Common story.
it's right. In
Yeah.
the 70s now, I
Right.
graduated out of the class of 1970, but from 66 to 70, she made that comment to me.
Wow.
And I said, what? And I wanted to say to her, well, what is the major difference? The nurses assist the physicians. They're both working towards regards of the patient
Right.
and so forth. But why not aim for the top?
Yeah.
And
Exactly.
so it was not a simple choice. I didn't have anyone to, ahead of me in the family as a guide as to
Right.
what to do or anything. I just said, this is what I want to do. And it's a long story, you starting me at medical school, but I can tell you the story about why I wanted to be a doctor.
Please
Oh
do.
yes.
It's a long
No.
story.
Take us back.
Okay,
That's what we're here for.
But my mom had 2 sets of kids in groups of 3. So the first 3, I was a year behind my older brother, and then I had a younger brother that was 2 years behind me. And the 3 of us were very close
Okay.
before the second 3 came along. And in high school, my older brother, the one that I told you about starting the Commodores, he was a football player.
Okay.
And I
What
was
was
a
his name, by the
majorette
way?
in the band, Michael Gilbert.
Michael
And you
Gilbert.
could probably look him up. But he had an injury,
Okay.
and dislocated a shoulder. And the coach, as is in a lot of schools and even now, he popped it back in.
The coach did.
But yes, the coach did. Because we had one orthopedic surgeon in our small town.
And where was the small
he
town?
was Pine Bluff, Arkansas.
Pine Bluff, Arkansas.
Martha Mitchell put Pine Bluff, Arkansas on the map because she was the wife of Attorney General John Mitchell.
Oh, I see. Okay.
But be that as it may, and she was a character. But it was a small country town in the South.
Okay.
And we had one Caucasian orthopedic surgeon, and he was on a fishing trip. So my mom said that, okay, you're going to be his nurse. And my 2 brothers had bunk beds. So we came up with the bright idea, not knowing anything about medicine, because we could see that the shoulder was getting swollen and the tissues were getting sort of distorted and ugly looking. So we put him on the bottom of the bunk and tied his arm up to the bottom of the mattress under the top bunk to sort of like
That's pretty
not
good.
knowing anything about medicine, thinking that maybe the fluid would go back the other way. And I had to feed him and change his bandage and care for him until the orthopedic surgeon came back that Monday.
From his fishing trip.
Yeah, from his fishing trip. He
Yes.
fixed everything, took care of everything, and my brother was fine thereafter. But I said, how could we just have one specialist in this town that would know how to do something like that when we have multiple high schools? We have kids playing all kinds of sports, from basketball to football to whatever, and injuries are prevalent, as you might know. So, but anyway, to be that as it may, I made a determination then that I was going to do medical school, and people say,
And how old were you at this point?
I was maybe 8th grade,
8th grade.
7th grade,
Okay.
something like that.
Wow.
And then as time progressed, when When I was in high school, it was after Brown versus Board of Education, which you guys know came about in 1954. I graduated from Merrill High School, Pine Bluff, Arkansas in 1966, which was 12 years after Brown went through.
Yeah.
And still, it was totally segregated.
It's still down south.
Okay.
Yeah.
So I could tell that my textbooks have been used because they were written in. And areas were underlined or starred that were important, okay?
Yeah.
And the kids across town, they had the brand new textbooks. And we took the next edition that they didn't have. Also, you would see, in our bio labs and things like that, 5, 6, 7, 8, 9, 10 of us would be gathered around one microscope.
Right.
Across town, each kid had their own microscope.
How did you have that reference? Did you know people across town? Or
No, I just eventually, I asked because I was always an inquisitive person, and my mom was an educator. She was a teacher herself in elementary school. And again, it was strictly segregated, but there was often communication or people would tell. Okay. In other words, we weren't allowed to even drive anywhere near their school or even in the neighborhood. But it's hard to hide information, so data would get out and people would find things out. So they knew what kind of situation we were in. They had their own pond where they could investigate algae and biology things, and that we had the ravine in a swamp that we walked across. It had moccasins and things like that could kill you. That's what we had. But we learned and we were informed later. When we were going through it at the time, you did not always know what you had and what they had. But if you were smart enough, you could surmise.
You could figure it out.
Yes. You knew that someone had used your textbook.
Yeah, the used book is coming from somewhere.
When you got dog ears, and everything like that. And you knew that we didn't even have 2 kids to share a microscope. I mean, it's virtually impossible to have 5, 6, 7, 8 kids around one lens. As you can imagine,
Do you see it? Do you see it? Oh, I see it.
And you're getting tested on it. Exactly.
And to know that Brown had basically stricken, segregation, but the South was very slow to respond. Very slow to respond.
So you knew all of that. Yeah.
Yes, I knew all of that. And I started in my career because even after Brown came out, the National Presbyterian Church from New York City, and I say that they decided they were going to do an experiment, but they had a program and it was called SSSP or something like that. And basically they went through the South and they were testing the theory about separate but equal. It was never equal. It was always separate, but they were testing the theory. So what they did was they went through all of the high schools that were segregated in southern states. So Alabama, Mississippi, Arkansas, Georgia, Tennessee,
Alabama,
Florida, all across. And what they did was they tested the students, and they took the one female and the one male who scored highest on their test. And they offered us a summer sort of like internship camp situation where we went to Knoxville College. University of Tennessee, now it's called University of Tennessee, but Knoxville College, and it was segregated back at that time. And they had teachers from New York City and the Presbyterian Church who came down and taught us concentrated math and English reading skills. And then we got tested at the end of every week, and everybody who did well, you got a treat. We had dinners where we had to dress up. Guys had to put on jackets. They did the whole thing. Manners and the whole thing. And if we completed the program successfully after the end of the 6 weeks or so, we were treated to a trip. So one year we got on the bus and went to New York City. Another year we went to, Disneyland, Disney World.
Oh, that's pretty
Florida,
fun.
those kinds of things.
Wow, okay.
But when the program was over, what was supposed to happen was we were supposed to apply to 7 sister schools and the Ivy League and things like that. in order to integrate the schools.
I see.
Okay.
Okay.
And
So you kind of groomed for it, I guess.
Yes.
That program.
When the program first, yes, and my high school was an excellent school, and I have to say that the teachers really cared about the students. And I mean, the mayor of our city eventually was a graduate of our high school.
Okay.
We had concert pianists and opera stars and all of that came out of that school.
Wow. Okay.
But I think I was the first MD to come out of that school. But
what was the name of the school?
Merrill High School, Pine Bluff, Arkansas.
Merrill High School.
Yes, it has a storied history in the state of Arkansas. But be that as it may, basically, when you finish your few years of summer programs, I think I did it maybe twice. When you got into your senior year, you were supposed to fill out these applications to go to places.
Okay.
Okay.
To schools.
And yes.
Okay.
Yes.
Okay.
In the Northeast.
Oh.
Basically, all of them were. And so they sent the information to our guidance counselor, and she talked down to my parents, and she said, "Oh, this is pie in the sky. It's not really realistic. You need to go apply to Howard and Fisk," which I did do. Applied to Howard and Fisk. I got into both of those. And my mom had one sister with two girls, and my cousin that was the same age as I was, she ended up going to Fisk and graduating from Fisk.
Okay.
But be that as it may, the Presbyterian Church reviewed all of their records. And so they called down to the high school and they said, "What happened to the Gilbert girl?"
Oh, wow.
That was me. "What? We don't have her paperwork. What are you doing?" Da 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 da. So then they pulled me out of class, and the counselor was getting all upset. And my mom was trying to explain that she told us that this wasn't worthwhile. We should be doing this and anything. Anyway, the bottom line is they said, "Look, it is not too late. It's only too late for one school, Radcliffe College."
Okay.
So anything else on here you can apply to.
Yeah.
And at the time, JFK was our president.
Okay.
So, and I knew that Jackie had gone to Vassar. So I said,
wow.
"Okay, I'm going to do
That
Vassar."
is awesome.
Okay.
That's great.
And then I think I did Mount Holyoke.
Okay.
Yeah. And basically, everyone I did, I got into.
Nice.
And when I got into Vassar, I said, because she went there, I'm going there.
That's so
And
funny.
so, and
Wow.
that is the story of how I got there.
How you got to
And of course, I was a full scholarship student. My uncle was a minister. My mom's one sister was married to a minister, and he had funds and things. So he would, we got to go to New York City as a family when she graduated from Columbia, and see the Empire State Building and all of these fancy things.
Far away from Pine Bluff.
far away from Pine Bluff, Arkansas. But he let me travel with them some. So because she had two girls and one of them was the exact same age as me, and we were almost about the same size, they would dress us like triplets. And of course, my aunt was buying the clothes and everything. And when I was in Knoxville, she would send me these big boxes of clothes and food and snacks and things to eat. But make the long story short, that's how I ended up in Vassar College. Now, once I got to Vassar College, you can imagine that was a totally different environment.
Had you visited before you went? Or?
No,
Oh,
I didn't have the money to go visit. They just said, "Which of these schools do you want to apply to?" That was it.
Yeah.
Jackie
So,
Old School.
So my uncle flew me up there. He took me to campus. My very best friend from Vassar now, she's a PhD in Atlanta, Georgia, and my one godson is a director at Morehouse. He's the head of the psych department and all that. He gives TED Talks and things like that.
Okay.
But
what's his name?
David Rice. David Ball Rice.
Okay.
He's a PhD at Morehouse, head of psych department, and has some other big titles. But be that as it may, I met her the very first day I got there, and this was the first class at Vassar where they had more than one or two black girls, women of color. Okay, so in our class, I think there was maybe 10 of us. And we were scattered from all across the United States. So like Kansas City, my best friend was from Virginia. There was a girl from Chicago. Maybelle was from Baltimore.
That's
so,
cool.
we had everything from the little country towns to the big city ghettos, the whole works.
So how is that meeting, like seeing another, black person at Vassar?
It was, we were the rebels because again, this was 1966.
Yeah.
So our class was the class that sat in at the main campus, and
Okay.
we made a lot of changes
Good.
there, and but it was a totally different environment, and it was like being a big fish in a little pond and then going to a giant ocean.
Yeah.
Because everybody there was valedictorian or straight A students, or what did they care about 4 point something plus from Pine Bluff, Arkansas, as opposed to? But at any rate, that I kept that dream about being a doctor, and so I would. Because I was a scholarship student, I was expected to have a work thing. So I worked in the biology labs, cleaning out the rat trays and the mice and all of that. And I took all my required courses, like, you had to take physics, you had to take chemistry, you had, they have these things to discourage you along the way. So I'm like, when did I ever use physics and radiology?
I'm telling you.
I mean, I used my physics, but not what they were talking, and biochem and some of these other things.
So true.
But be that as it may, I did all that. And as you can imagine, people applied to Harvard Medical School other than me. So it was a huge disappointment in the class.
Yeah.
When I got in, and some other people who had higher grade point averages didn't get in.
Oh.
Because this was in the day when Harvard, it was, before King was assassinated. Because he was assassinated when I was at Vassar, because I remember being in the library there. So
how was that?
A lot of the schools, you just, people were just walking through the hallways here. And I was studying. I'll never forget it. I was in the main library. But Harvard got it in their mind that we have to do a better job. And so they set out to have Dr. Alvin Poussaint, who retired a couple of years ago, and you can look him up. He was a person that was supposed to watch over these black kids, because my husband was at the dental school in the class of 73, and they had one black female in their class, and then a number of males. And then when my class came along, the class of 74, there was like 6, 7, 8 of us. So a few girls from Spelman, there was me, there was another girl from, New York City, Bryn Mawr, someplace like that. So it was an experiment by the school, and we all talked about it, and we knew it. So we knew we had to do well.
You had to do well.
And so we studied, and we worked, and we passed test after test after test, and we did everything we had to do to get out of there.
Right.
And it was a come down, because again, you were the superstar at your high school, and you were a good student at your college, but this is a whole nother level.
Different level.
So I didn't even care if I got a C in something in medical school. The important thing that I wanted to finish every class, every rotation, do the very best that I could, and then I was going to go into some kind of residency internship program.
That's great.
And back in the day, they felt that women should be either in OBGYN or pediatrics. You guys know this story by now. And so I said, okay, I'll do pediatrics. I'll do the kids. And I had a pediatric rotation at Boston Children's, where I was seeing every kind of sarcoma known to man. And it was depressing. And I had one guy put his fist through the wall by my head, because I was taking care of his child that had already had an enucleation of one eye for retinoblastoma. So it was a very, and I was seeing different sides of pediatrics. But they said, if you're sure you want to do pediatrics, why don't you go into some specialties related to pediatrics? So I went into pediatric radiology.
Oh, interesting.
And that's when it hit.
Yes.
Because this was back when everything was on film.
Yeah.
You remember? So you would take a break for 10 to 15 minutes, and the aides would come out, and they would load all the black films, and you would push your foot on the button, and the Rolodex would go around, and all the x-rays would pop up, and everybody was coming to the radiologist to figure out what to do next.
Yeah.
Is this lung cancer? Is it pneumonia? What segment is it? Is it the gallbladder? Is it the pancreas?
The
Is
coach.
it the liver?
The coach,
So
that's right.
this was back in the day.
Yeah.
And I said, these people are really smart.
Yeah.
They are directing the management, even though they may not be touching the patient right now,
Uh-huh.
right this moment. These people are drivers. They are movers and shakers
Exactly.
of what's happening with these patients
Yeah.
because the surgeon
Right.
doesn't know where to cut. They don't know what to do. They don't know what antibiotic to give. They don't know if this is a virus, a bacteria. Da, da, da. So I said, I like this stuff. So then
Yeah.
I did that one.
Uh-huh.
And then I did another one, I think at New England Deaconess.
Mhm.
And then I said, I'm going to do this. And there were very few of us who came out of my class that said that they were going to do radiology. One other black guy and me, and then, a couple of them. And then I was determined to do it. And so, what do you do? You apply to programs.
Mhm.
And I got into Penn.
Wonderful.
Wow.
Wonderful.
And
Great program.
the rest is story.
Yeah.
And the way it started out though is when I met my husband. I told you about everything that happened to my husband. We married when I was in my senior year of medical school, and he had graduated, and he started dentistry because he was from Detroit. He started dentistry at the University of Michigan.
Okay.
So when I applied to radiology, I got into Michigan, and I was there with him.
Oh.
But then we hit this snag because my mother-in-law was driving me crazy. And she would come up from Detroit with her little tennis skirt on. And I had been in the hospital for 2 nights in a row because Michigan had Jackson Prison and all of that.
Yeah.
And this was back in the day when, you had to, they weren't interested in, your cognitive abilities and too much stress and your eyesight. So, you would come in early one morning,
Mhm.
you would stay all night, you worked all the next day. And if you're lucky, maybe you go home that next day.
Wow.
So she showed up on our doorstep in her tennis skirt when I had been post-call. And I was like, okay, this is it. We are not going to last here. We got to get out of here. And my husband had a dental friend who was from this area.
Okay.
And
okay.
he was at Penn Dental School.
Gotcha.
So he told him, he said, man, you need to come here. We need some more people here, that look like us, and blah, blah, blah. And so I applied. And as it turns out, the radiology department at Penn, the residents were upset and getting ready to strike because they had too much work and they were going crazy and everything. And they were like, this is nuts. This. And this was back in the day when Penn was not an academic department. It was owned, by this guy as like a private practice and everything. So it was a mess. And then Stanley Baum eventually came in from Mass General and turned it into an academic department. But they needed more resident help because the residents were saying that they were making mistakes and the call was too just horrific and everything. So I interviewed, and one of the best teachers there, Dr. Wally Miller Jr., he asked me, what did I think about the Black Panthers in my interview?
Oh, my gosh.
To show you where we were
Yeah.
back then,
Oh, yeah.
okay? Now, this is we are now in the 70s, okay?
How'd you get out of that?
So, I don't even remember what I told him. But you know what? I gave him this look, and I just kept on moving. And I said, you don't have to worry because I am not going to start a revolution here. And then when they accepted me and I came in, I passed by one bulletin board, and there was a notice that says, let the new girl do it. So it was that kind of environment. But I just said, okay, I got this. We're going to do it. Yeah, that's right. You got it. Yeah. And so I did a phenomenal job. And when Dr. Baum came from Mass General, they kept it a secret. I didn't hear about it, but they had a big debate about who was going to be the chief resident because he wanted me because I came from Harvard, and the older people that were there said that she didn't start with this class. She came in the middle of the first year after 6 months.
Yeah.
She shouldn't be the chief resident, da-da-da-da-da. So they made one of my friends, a white male, John Bonavita, but the vote came down between the two of us, and the older people said that he started the class, and I didn't, and I was like, coming in the middle. So he should be
Wow.
it. So he was a chief resident. He went into private practice to get a lot more money at Chester Crozier.
Wow.
And he stayed in private practice, and then he eventually moved to New York City. I stayed in academics, and I'm the professor.
There you
And
go.
I'm the
There it is.
person
There you
who
go.
lectures internationally and does all this stuff. And
Exactly.
Dr. Baum and I are still friends.
Wow.
Yeah,
That's
he
really
lives
good.
out
That's
in
great.
Chestnut Hill to this day. But secrets are hard to keep in
Oh,
radiology
absolutely.
or in medicine in
It's a
general.
small world.
It
Yes.
is a
very.
small world.
Yeah.
And what you see on television on these medical shows, it is exactly what happens. And the truth will eventually come to light. So,
Dr. Coleman, how did you? So I want to go back to a time where you were just an academic all-star. What do you attribute that to? I know your mom was an educator,
Yes.
but it seems like education and academics were a breeze for you.
well, in the sense that, you can look at academics from a number of ways. My older brother had the highest IQ for a while. Okay, and the one that did the Commodores, he could he could see some electronic and just but he was not a worker. And then in the younger three, I have a sister who had an IQ of 160, so she had the higher of the younger three.
Yeah.
And again, she has not necessarily lived up to all of her potential. She has a couple of masters, but she could have done a lot more. But I was the one that had the drive to say that I want to do something that has never been done before in the family.
Yeah.
Now, as it turns out, I told you my mom was just inseparable from her one sister, my aunt. And my aunt had two girls, and my grandmother was an identical twin girl. So of the three of us, me and my two cousins, they said, okay, one of these girls will have twin girls. So my younger cousin had identical twin girls, and one of them is a pediatrician in North Carolina.
Wow.
Okay.
And so there's now somebody else in the family, and then the other one is an architect in Chicago.
Oh, wow.
So we have always been brainy.
Yeah.
Okay. My grandfather owned a dinette. That's what it was called back in the day. You guys would probably call it a college diner now.
Okay.
In Pine Bluff.
Way back in Pine Bluff, Arkansas. And
Okay.
he moved to Pine Bluff, Arkansas, which was a college town. That's where the college was
Yeah.
for black kids, because he said that he was not an educated man, but he wanted his two daughters to be educated.
Wow.
So he lived
that
in a
foresight. Wow.
smaller town, West Helena, Arkansas.
Okay.
And he moved to Pine Bluff, and he opened this diner on the college campus. And all of his clientele were the students, the professors, and all of that. And, when he died, they, there were all these testimonials about, Mr. Eli fed me, even when I didn't have the money for lunch or dinner.
Wow.
Yeah, he could tell. He knew what the students were going through, and he would give them food. Way back in the day, if they were hungry,
Wow.
and they and kids were hungry back in the day.
Yeah.
Anyway, to make a long story short, my mom and my aunt both got their undergraduate degrees from AM&N College. It was called Agricultural, Mechanical, and Normal College. It is now called. It's a branch of the University of Arkansas.
Oh.
And the main
okay.
campus of the University of Arkansas is in Fayetteville.
Yeah.
So my mom went there. So my mom walked across the stage with her college degree in 1948 when she was pregnant with me.
Oh,
And I was
wow.
born in August. So she was a toughie.
Yes.
And I tell them, I said, I think my granddaughter is reincarnated from her because my daughter named her Carrie, and I swear she's going to be a toughie.
Yeah.
Okay,
Yeah.
but
Oh,
my
wow.
mom was like, if you told her you couldn't do it, then that just made her that
about to get done.
crazier.
Yeah.
And again, we lived in this very segregated town. The post office said that they had not a single black person who could pass the examination,
To become a post office worker?
Yeah, to be,
Wow.
Wow.
You remember the federal exam.
Yeah.
And they said that, and she said, this is crap, this doesn't make sense. I know my daughter could pass the
Right.
exam. And I did with flying colors. And, still, you hope for the best. I was like all of 80 pounds soaking wet. And she thought they were going to give me a job at the stamp window. Okay.
Oh, okay.
They offered me a 250-pound backpack.
Oh, geez.
Okay. To
They
walk
made it hard for
outside
you.
and
Yes.
she said, "Oh no, she's not doing that."
They did that
But
on
we
purpose, of
proved
course.
that we could pass the exam.
Right, right.
The federal qualified exam. And that's what a lot of all of that was about. But my grandfather was determined that his daughters get educated. So my mom got her master's degree, and she was from the large Caucasian university. So
Yeah.
she
Went through it.
And
Yeah.
she was a special education teacher. And my aunt got her master's degree from Columbia University in New York City, and
Wow.
eventually got a PhD. I don't remember where, but she was the first Montessori principal in the state of Tennessee,
Really?
white or black.
Wow.
Okay, so they always were heavy into education, and neither my grandmother or my grandfather on my mother's side had a formal education, but they were determined that their daughters would be educated.
They put them in an
And
environment.
so
yeah.
then, from then on, their daughters' children, all of us have,
There's a legacy of being
yeah.
educated.
all of us do something, and
Wow.
all of us have college degrees or higher degrees and things like that. And I told you about my niece that's the pediatrician in North Carolina. So that everybody just kept on doing and normal things, but then things that we thought were really important. My grandmother's, again, on my mother's side, she was the one who was married to the guy who opened the dinette.
Mhm.
He got his PhD from Cornell in agriculture.
Oh, wow.
Way back in the 40s, one of the first, and
I'm
he
sure he's one of
was
the first.
working at this college campus. So when my niece got her PhD, when she got her master's, she looked up his degree at Cornell
Okay,
when she
okay.
got her master's in architecture. Yeah, she said, "I'm going to look up Uncle Celis's degree," and it's in the archives.
Really?
So so we had people who were very interested in higher education in
Yeah.
our family, and our family kept pushing that.
Yeah.
And I will say right now to my daughter, Malcolm X says, education is the key.
Mhm, mhm.
There you
Okay,
go.
they fear an educated black man or woman.
Mhm.
Okay, some people still do.
Yeah.
And if we get that education, they can't hold you but so far back.
Yeah.
All this
Exactly.
information about the tremendous wealth gap that we still have not overcome,
Right.
and all of that is overcome with education.
Absolutely.
So yeah,
Yeah.
so
That's
so
one of
it's
the biggest
really,
determinants.
really critical to push that. And when we were supposed to have 3 kids, we had one. We learned early on that she couldn't stand the sight of blood, so we said, okay, medical school's out, dental school's out. She said, what about dental school? She said, that's just bloody teeth.
Yeah.
What about veterinary school? I like animals. That's
That's
just blood
blood.
with animals. So we were trying to figure out what in the world was she going to do, because she was more verbal than scientific.
Okay.
And my younger sister got her undergraduate degree from Brown. And when she graduated, because we were up here on the East Coast, my parents would bring her up here, we would take her to school. And my daughter was like, 4 or 5 elementary schools. She would go there. When my sister graduated, she met the president of Brown. She said, oh, I want to go to this school. We
Done.
said, you have to be really smart to get into this school. But to make a long story short, we lived in New Jersey for a long time. So we, because I was away from home a lot, my husband was away from home a lot, my daughter was in the Quaker system. So she started at age 4 at
Oh, I
Morristown Friends School
Okay.
and went to graduation. She got into Brown. She revived the African Sun, which was the black newspaper, which was going
wow.
down under.
Okay.
And she was a DJ on the black radio there. Got that
Brown,
rev
wow.
back up. Then she went to Columbia School of Journalism.
Oh, wow.
And she
Okay.
got her master's in journalism. And she is a television news anchor here in Philadelphia, in NBC 10. She does the news from 4 to 7 every morning. She
Yeah.
makes almost as much money as I do.
Oh, that's so
we
good.
both had to take pay cuts for COVID, but she
You
has
can
a
see her on
big
TV. That's
six-figure
wonderful.
salary. But we knew that she wasn't going to be a medical student. So we said, what is your forte? What are you really good at? And
Yeah.
she's very verbal like me. And we had nobody in the family in journalism.
All right.
So
Wow.
we said, okay, we can start a new career,
Yeah.
something new and different. So her kids, whenever they feel like it, they can wake up in the morning and see mommy on TV, and they just blase,
Exactly.
it's mommy, we're not paying any attention, blah, 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 blah. But
They'll be
we
inspired.
have to enforce that education.
I agree with you. Hit us on IG at Reading Room Talk and drop a line or voice note to readingroomtalk@gmail.com so we can discuss your case. Please subscribe, rate, and review on iTunes or wherever you get your pods, preferably between cases.